We have a long history of training pharmacy residents at UAB Hospital. Our pharmacy residency program is one of the oldest in the country and has been accredited since 1970. I would like for you to see and hear from some of our current residents and why they chose UAB Hospital for their residency training.
I chose UAB's pharmacy residency program for a lot of different reasons.
I really felt like I really matched really well here and really felt like part of the family.
I knew that there was a wealth of opportunity here at UAB with all the different electives that you get to choose from and different rotations and things like that.
Like oncology, solid organ transplant, critical care, and now infectious diseases. So I liked having that kind of opportunity to further my learning.
The Hematology Oncology unit elective is especially wonderful because it is affiliated with our comprehensive cancer center that is nationally ranked.
So currently I'm in the bone marrow transplant clinic, which is really a unique opportunity to kind of talk to patients and see this really specialized area as a pharmacist and kind of where your role is in that.
I think the preceptors are a real strength of the residency program here. Something that I've specifically dealt with is how they balance giving residents autonomy but support at the same time. So depending on how comfortable you feel on the rotation, they'll be there with you on rounds, or if you feel like you're ready to go by yourself and kind of fly solo, they're totally open with that happening as well.
So one way that they help us achieve our goals is we get assigned a mentor. It's been so great to just go to them for advice anytime that it's needed and just simply talk through things that you may not be understanding or anything that may come up throughout your residency. They're always there for you, and I've also found that our preceptors as well as administrators have a lot of respect for us.
My typical day involves getting here fairly early to work up patients before rounds so that I can really make a difference on interdisciplinary rounds and be able to offer recommendations to better each patient's pharmacotherapy regimen. After that, I follow up with any issues that arose during rounds and answer any of the team's questions. Interspersed between all of these things, I verify the orders for my unit so that I can actually see that the recommendations are followed through on appropriately and just be able to track different developments with my patients based on what orders are coming in for them.
I would say the first half of the day is dedicated towards patient care, and then after lunch is normally when we do follow-up with things that didn't get done on rounds. And then topic discussions are usually in the afternoons, and then any meetings that I have both for rotation and outside of rotation is usually something that I take care of in the afternoon. And then one day a week, my afternoons are dedicated to clinic.
So one of the stations that there is the IV room, and that was where I was pretty much the majority of my time in central pharmacy rotation. So the IV room is simply where the technician is inside the IV room and they're making those medications and all those products to be sent out to the floor. And the pharmacist is stationed outside of the IV room to verify those medications. So outside of the IV room, there's also a compounding and production area where they're making a lot of the baby medications and the oral suspensions. So all the pharmacists in this area, they're typically rotating through each day, and they're keeping them on their toes, definitely, and making sure that they improve on their skill sets as well.
Right now I'm on infectious diseases, so I'll come in the morning and I will work up my patients in the morning, do some light reading, and then I'll go run the list with my preceptor. And then after that, I'll head to rounds. Afterwards, I catch up on any new patients that come in. Run the list again with my preceptor, and then after that, we'll do second round of rounds, and then I do more reading. So a lot of reading.
So currently I'm at 1917 HIV clinic. With this clinic, I'm working with the fellows, the infectious disease fellows, as well as the attendings, and getting our recommendations across, whether it be things like hypertension or diabetes and other general disease states on top of their HIV that we're controlling.
One of the things that I really underestimated as a student when I was looking at residency programs was how important it was to have a great PGY1 cohort. And so my co-residents have been a great support for me.
Your co-residents are the only people that really can relate to exactly what you're going through. So they provide a wonderful support system that's just instrumental to success, I think, in any residency program. Additionally, we all share the same office, so that's been extremely beneficial in building camaraderie and just being able to share experiences and get to know each other.
The expectations are of course high, just as in any other pharmacy residency, but I think that the expectations are manageable, and the program really works to make sure that the expectations are something that can be done as a resident, as a new pharmacist as well.
Our pharmacists are committed to providing the highest level of patient care. As a pharmacy resident at UAB, you'll work on developing your skills as a pharmacist. This includes problem solving, communication, and time management, in addition to learning how to best manage many different clinical and medical conditions. The practice model at UAB Hospital allows for a great training environment. Pharmacists at UAB are responsible for all aspects of drug therapy, and this allows you to become competent in all areas of pharmacy practice. This experience prepares you to practice in a healthcare setting, whether it's a large academic medical center, a community hospital, school of pharmacy, or ambulatory care clinic.
Thank you for taking the time to learn more about our pharmacy residency programs at UAB Hospital. We are so glad that you are considering us for your residency training. If you would like to find out more about our residency programs, please contact me. I would love to talk to you about our programs.